Hi everybody, Dr. Daniel, and today I'm talking about does transient global amnesia, TGA, relate to migraine? Wow, what a confusing, difficult area. Well, Morris Bender in 1956 wrote on a syndrome of isolated episodic confusion with amnesia, and that was the start of the first modern USA physician-known series of cases on transient global amnesia, and that was named by Fisher and Adams in articles they wrote in 1958. So TGA is commonly found with migraine, and migraine's spreading wave of depolarization sweeping across the hippocampus may be what causes it. This is an area of depolarization of the cells, the glia of the brain tissue that occurs transiently, then it goes away. It's first described by Liao, and it's applied to what is thought to be the cause of migraine with aura attacks. Now, I wrote a big book on transient global amnesia, in that it's like over 400 pages long and has 554 references. And I divide the subject into clinical, EEG, CAT scan, SPECT scan, PET scan, sonogram, and MRI papers. And I talked about associated medical conditions that could cause it. I reviewed articles in the etiology, which has always been a problem. What is it causes the transient global amnesia, which is one of the big mysteries in neurology, causes little dots in the hippocampus right at the time the patient has the attack. They're seen on MRI scanning that go away a day or so later. So what is it? There have been all these opinions and things that come up about it. And then I had chapters on clinical work and treatment. So you could get that on Amazon if you want to go there through my name. And so the question has been, does transient global amnesia relate to migraine? So the medical literature on migraine transient global amnesia shows a positive relationship in certain cases, and TGA is one of the most mysterious conditions in clinical neurology. Occurring only once in middle to late age, the affected person is usually robbed of memory for the past, the present, and some for the future. Repetitive questions occurs without learning the answers supplied in the typical case, and frightened family members rush them to the emergency room for a CT scan or MRI scan thinking they've had a stroke or brain tumor or something, which is usually normal unless it shows these little dots I just mentioned. Although the cutoff time for duration is 24 hours, most times the attacks occur into 4 to 6 hours, but leave a little core of amnesia in the middle of that where the patient doesn't remember anything. So to develop the idea of transient global amnesia, I'm going to talk first about cases of migraine that may be associated with amnesia. And I came across this literature when I was writing my big book on migraine, which is also available to you if you want to look at it. So Living, who's a neurologist's supreme cataloger of everything regarding migraine, wrote in 1873, I'm just going to read his writing, "We have next to consider the disturbance of the higher cerebral faculties, which sometimes attends the migraine paroxysm. This may be regarded for the most part as either intellectual or emotional. The former is represented by some instances by loss of impairment of memory, and in others by confused, incoherent, or tumultuous ideation, very rarely by hallucination, the latter by general depression or vague subjective feelings of anxiety and dread." Okay. At this period, following the affectation of sight and touch, her intellect becomes confused, and her memory at this time for about half an hour is so much impaired that she can't remember the name of any medicine she's just taken. As the visual phenomenon passed off, he's talking about patients here, his memory used to fall so much for a time he's mentally incapacitated. Whatever he read or did during that period of time left no impression. Now, Living did not describe typical benign TGA episodes, and he wrote an encyclopedic monograph on migraine in which he recorded mental symptoms that his patients experienced during attacks. So he studied 67 patients, and 16 out of his 67 patients had confusion, trouble with memory, or a disturbance of consciousness. 9 of the 67 patients had the onset of the migraine before age 20, and the youngest was at age 9. But after Living, 1873, Confusion as part of a migraine attack was rare in the neurologic literature. Then Flauto, writing in the Handbuch der Neurologie, a German book, in 1914, confronted the problem of migraine and mental symptoms. He called the problem Dämmerzustand. I'm not German, I don't speak German very well, but that's what he was saying. He proposed that the term migraine equivalent not be used unless, quote, the psychosis occurs in a person who also suffers from unquestioned migraine attacks. When the cessation of the hemicrania and the beginning of the psychosis approximately correspond in point of time, and when the form of the psychosis is the form most frequently encountered in migraine, i.e. confusional migraine. So this German doctor is calling a psychosis amnesia. These terms were kind of loosely used in that time and later have been firmed up in the meeting. Mersch, writing in 1924, the American Journal of Psychiatry, this is one of the early Mayo Clinic neurologists, Dr. Mersch. He wrote on psychic manifestations of migraine. He said that, quote, during the clouding of consciousness, amnesia frequently occurs, and reported 2 patients with amnesia during migraine attacks. And he also looked at the literature and reported on Hall, who in 1840 noticed the relationship of sick headaches to psychic disturbances such as stupor, delirium, and unconsciousness. Living and his excellent review of the subject tabulated cases of this as well. Living had confusion, impaired memory, depression, drowsiness, terror, and so forth. And also then there was another writer named Magazzini who coined the term dysphrenia hemicrania transitoria. So all people were applying these terms to this condition to describe these psychic alterations. He classified them as abortive, transitory, or protractive. Flauto considers that migraine psychoses are an entity and not to be confused with epileptic equivalents. In his study, he found that the confusional states are the most commonly associated mental changes with migraine. And this is in the age before CT and MRI scans. Morris, I'm going to read you one of his cases. Case 1, a patient aged 42 had periodic sick headaches associated with scotomas, that means a blind spot, nausea, vomiting, typical migraine stuff, since the age of 4. There was no history of migraine in the family. In July 1918, he awakened a friend by talking in a natural voice of happenings of the day before. He was lying limp in bed and could not be aroused, but had no convulsions. After about 20 minutes, he regained consciousness, was extremely nauseated, and for 2 or 3 days had a severe bitemporal headache. In June 1920, a similar attack occurred during the day in which he suddenly, while walking, became confused in mind. This state lasted about 10 minutes and was followed by nausea, headache, and vomiting for a greater part of the day. In July again and in August of the same year, he had spells of similar character with a sudden lapse of memory, lasting from 5 to 20 minutes and followed by nausea, headache, and vomiting. All right, so those are attacks that sound like migraine. They're occurring in someone who's lost memory, reported by Mersch. Nielsen, writing in the American Journal of Psychiatry in 1930 on migraine equivalent, commented that psychic disturbances entirely replaced in the usual spectrum of attack of migraine have led to a great deal of discussion and some controversy during the past 3 decades. And he reported another case of a doctor who had memory loss during an attack. Evans, writing in the Brain in 1966 on transient loss of memory, an organic mental syndrome, stated that sudden loss of memory without gross evidence of clouding of consciousness is often regarded as consciously or unconsciously motivated. But some recent reports have indicated organic amnesia can occur without associated impairment in consciousness and can be distinguished on clinical grounds from motivated amnesia. And he had 3 cases who had a history, 2 of whom had a history of migraine and described migraine-type symptoms during the attack. They had, during the attack, a memory loss, tachopsia, which is seeing those zigzag lines, a one-sided headache that happened after a hot bath. But then, starting in 1958, I'm going to start now discussing typical classical attacks of transient global amnesia. Most writers credit Morris Bender with the first modern description of spontaneous attacks of transient global amnesia. In 1956, he wrote on the Journal of Hillside Hospital his account of a syndrome of isolated episode of confusion if I'm normal and conscious right now, it's like 4 o'clock in the afternoon on Monday, but I didn't remember noon till 4 o'clock. That would be retrograde, going backward in time. That's what that means. Thus, with these words, Dr. Bender swept into neurology and into medical awareness this unusual, fascinating, and disturbing clinical syndrome of middle to late life. In the same year, Gaillat and Corjan in France wrote about a similar thing. They gave it a French name, Les Ictus Amniques, in the Journal de Médecine de l'Eye, and described the same syndrome. So this is true all over the world. This has happened with other problems. Cluster headache had an example of this, where people call it all kinds of names, and probably finally in the 60s they got it all together and started calling it cluster headache. So here these French gentlemen have a similar syndrome called ictus amniques. And that had been used by Binon writing in 1909. But then in 1958, Fisher and Adams, Mass General Hospital, writing in the Transactions American Neurologic Association, gave the syndrome in English with the title of their article, Transient Global Amnesia. And this is the name that stuck. And after that, everybody, the literature has been written, have all used that name. And they pointed out that the clinical manifestations were limited for the most part to a defective memory, involving the events of the recent past and the present, but leaving personal identification intact. Recovery appeared to be complete. Fisher and Adams claimed they described a distinct clinical syndrome which has not been clearly described in the medical literature. The attacks came suddenly, without warning, or symptoms of seizure or motor or sensory deficits. So when they said that in 58, they didn't know about Bignon in 1909 in France. The writers in French also in 56, and Morris Bender's article 56, they just didn't get it together. We didn't have the internet then to chase all this stuff down. All right, then Gilbert and Benson, writing in the Journal of Nervous and Mental Disease in 1972 on transient global amnesia, report of 2 cases with definite etiologies. They describe 2 cases. The first was a typical attack of amnesia with repetitive questioning, right frontal throbbing headache, and remission of symptoms in a few hours. The patient had a 25-year history of paroxysmal throbbing hemicranial headache, often preceded by scintillating scotoma and associated with photophobia. He experienced a period of amnesia for a period of several hours the night of his admission. So there you have it, within the middle of a migraine. Migraine is the most common symptom of migraine is it's one-sided, and that's called hemicrania. Throbbing, migraine dilates the arteries and constricts them and makes them painful when blood pulses through them. So they're throbbing, hemicranial headache. Scotoma means a blind spot, and scintillating means it flashes. Associated with photophobia means fear of sensitivity to light. So migraine has fear of sensitivity to light and sound. All right, then Heathfield et al., writing on the syndrome of transient global amnesia in Brain in 1973, described 31 patients with amnesia from different etiologies that he thought were transient global amnesia, epilepsy, migraine, temporal lobe encephalitis, and psychogenic. Then Oliveris and Jensen, writing on transient global amnesia and headache in 1979, reported 5 migraine patients with TGA, and 2 of them had from their series follows. A 58-year woman without a family history of migraine. Since the age of 25, she suffered from attacks of one-sided shooting headaches on the other side associated with nausea, vomiting, photo and photosensitivity. Previous attacks occurred on weekends. All right, during this time, she had a headache with one attack, and she had full memory of the following 12 hours, but then 20 minutes after another suppository, she got amnesia occurred and continued for the following 12 hours. Her husband found her disoriented, asking the same questions repeatedly. Here's someone in the middle of a migraine attack, in those days taking ergotamine as a rectal suppository for treatment. And she was admitted to the local hospital, found to be regarded, and scanned, and everything was okay. But then the great writer of transient global amnesia, Dr. Kaplan from Harvard, writing in Neurology in 1981 on transient global amnesia and migraine, described 12 patients with TGA and migraine. 6 of the patients had common migraine and 6 had classical migraine. And 3 patients had classical migraine with their TGA, and 9 had severe headache with amnesia. Kaplan also defined TGA for the first time as, he gave a series of things it should be. I'm going to read them to you. First, it should be inability to form new memories, repetitive inquiries, retrograde amnesia, initially encompassing a period of days, months, or years before the attack, but gradually shrinking after attack, leaving permanent amnesia only for the events during the attack, and absence of other neurologic symptoms and signs. This definition eliminated from consideration any patient with permanent retrograde memory loss or stroke or TIA type symptoms. So this is a transient event, not a long-lasting event. Kaplan advanced theoretical considerations that supported the possibility that TGA might be a migrainous phenomenon. These considerations included, he's comparing TGA with migraine. The abrupt onset and transient nature suggests a vascular etiology. However, patients with documented posterior circulation strokes had no preceding TGA episodes. Kaplan's a famous stroke writer. Writers who included amnestic deficits with posterior circulation occlusive disease also had other signs and symptoms, and the memory deficit were not transient. Vertebral-basilar occlusive disease is common. If TGA is a manifestation of vertebral-basilar disease, it should occur more frequently. He thought migraine was a common vascular disturbance with an unexplained biases for posterior circular vessel, and that's where it stayed for a long period of time. Kaplan talked about vascular spasms can be diagnosed or posited by a cardiologist having coronary angiography in some patients with angina pectoris. Vascular spasm occurs experimentally in the brain by putting blood in a subarachnoid space, which occurs after subarachnoid hemorrhage. The brain goes into spasm. Kaplan wondered if there might be, quote, instances of cerebral vascular spasm distinct from that usually labeled as migraine. What a great comment. They closed stating vascular spasm may explain TGA in some patients not known to have migraine. Kaplan also said that TGA had no definitive confirmatory laboratory investigations and fuzzy boundaries. His analysis provided later writers with a firm structure for defining the syndrome, which they mainly stayed with. Now, Olson and Jensen writing about spreading depression, and Dr. Olson is a really famous man in neurology, particularly in the International Classification of Headache Disorder, probably one of the most famous neurologists in headache in the world. He, in his article, stated that spreading depression could be elicited mechanically, electrically, chemically, thermally, and by sensory stimulation in experimental animals. It's a spreading wave of depression that moves across the brain, described by Liao, that is thought to cause the migraine with aura type events that spreads across the occipital lobe of the brain. But these could also go across the hippocampus and cause whack out of the thalamus, so it doesn't work at all. And he said attacks of migraine are associated with changes of regional cerebral blood flow, whereby at the onset of symptoms, cerebral blood flow is reduced at the posterior pole of the hemisphere. And the reduction causes, and it spreads anteriorly, means the front of the head to the forehead, at a rate of 2 to 3 per minute. And the authors thought that the relationship between spreading depression and migraine was, quote, so striking that spreading depression can be regarded as the most likely explanation of the aura symptoms of classic migraine. Also, they talked about a highly emotional experience excites the hippocampus, and neuronal activity liberates glutamate, which triggers a spreading depression, resulting in a reversible functional ablation of the hippocampus. So there's more of that on that. They spoke about it again in kind of a highly neurologic term, but I'm going to say it again. I'll say more on it, saying, since the hippocampus plays a central role in human emotions, the following sequence of events could possibly explain TGA, a highly emotional experience which excites the hippocampus. Neuronal activity liberates glutamate, which triggers a spreading depression, resulting in reversible functional ablation of the hippocampus. All right, so that was a great discussion by them. Then we've got Lynn writing in the European Journal of Neurology in 2014, stating migraine is associated with a higher risk of transient global amnesia, a nationwide cohort study. And he found that migraine is associated with increased risk of TGA, particularly in female patients aged 40 to 60 years old. But there's been no etiology agreement across the world as of now. I'm just building the case for migraine as part of the text of TGA. Predelaire and Lutz, writing in Headache in 2000 on transient global amnesia, migraine, also reported a case there that had a thalamic infarct. Anna and Donette, writing in Headache in 2015 on transient global amnesia triggered by migraine in a French tertiary care center, an 11-year retrospective analysis, and she found that TGA occurring during a migraine attack is rare, which is really not, as we've heard. There are many cases reported on that. She thought a Valsalva maneuver, such as forceful vomiting, is frequently described as the origin of the attack, and blocking venous return through the superior venous cava may allow a brief retrograde transmission of high venous pressure from the arms to the central venous system, resulting in venous ischemia to the diencephalon or temporal lobes and causing TGA. So that's another theory of what causes TGA rather than spreading depression. Then Menu, writing in Neuropsychiatry, Clinical Neuroscience in 2019 on the strong association between migraine and transient global amnesia, a national inpatient sample analysis, they stated that after a big study of a large number of patients, that migraine patients were 5.98 times more likely to have diagnosis of TGA compared with patients without migraine. So transient global amnesia is a sudden temporary episode of memory loss that can't be attributed to more common neurologic conditions such as epilepsy or stroke. You're scanning them later, so they don't have an infarct of the brain, so they don't have a stroke. And then also they've done EEGs at the time of the event, so they really haven't found that it's like epilepsy. During an episode of transient global amnesia, you recall a recent event simply vanishes, so you can't remember where you are or how you got there. In addition, you may not remember anything about what's happening in the here and now. Consequently, you may keep repeating the same question. The patient will say something like, what's going on, or what happened there? Why am I here, they say. But you don't remember the answers you've been given, so that goes on, which really frustrates family members knowing there's something diabolically wrong with this person. Also, I have a reference for the Mayo Clinic Family Health Book, 5th edition, and they say that migraine is strongly associated with transient global amnesia. The last little article I had here was Ken Morris, writing the JAMA on neural factors associated with the risk of recurrent transient global amnesia, and they found high prevalence of both personal and family history of migraine reported with isolated cases. So, in summary, after years in literature and article developments at Bender's seminal article in 1965, there's a large body of information. I've kind of briefly gone over that with you, linking TGA to migraine. And this review testifies that fact. So God bless all you folks with migraine, and any of you who've had TGA. Please subscribe down there. Follow me on YouTube for other videos I have. I'll see you again on the next talk.